Alright, this is Miss Emily, 21 years of age with a focal onset dystonia. Before any treatment processes have been undertaken. This is Miss Emily after 30 minutes of treatment using oxygen, some visual stimulation, some auditory stimulation, and some vibrational and some extensor muscle tonus. Let's check one more. After 20 minutes, patient's doing Romberg's. You notice that there's no facial movement, left or right, after 30 minutes worth of therapy.
My name is Emily Keeling. I'm 21 years old, and I was diagnosed back in April with idiopathic focal dystonia, and I started off going to doctors here in Lake Charles, and they really had no clue what was wrong with me. And so I then went to Houston, and I went to St. Luke's, and that's when I did 7.5 hours of MRIs, a spinal tap, and they ended up discovering that I had the idiopathic focal dystonia. And he referred me to a specialist at Baylor University in the Parkinson's Center. And the first thing that they did was, of course, get all my medical history and examine me some more. And I then after I went to Baylor, I then started doing medicine, carbidopa and levodopa medication for Parkinson's disease, and it never did anything. And so I went back, and then they then told me that if that wasn't working, that I would then have to be maybe put on antidepressants, thinking that it was stress related. So I then did the antidepressants, and that didn't work. Well, this was all over a couple of months, and then when I went back, they told me that the only thing left to do was Botox, but they said that because of my hand somewhat would open, which was very, very hard to do, I actually had to pry it open. They told me that Botox really wasn't an option, and so they kind of just told me just to stay on the antidepressants and just kind of learn to live with it. So I then found a pamphlet, and I started coming to the doctor here, and I was numb, and then after I started coming a few weeks, it was actually the first doctor that actually cared about me and showed me that there was more that I could do than just live with what I have. And so I then started doing treatment here. I'm doing a hyperbaric oxygen chamber and all kinds of therapy. And it's the first time I can actually open my hand and actually have some more mobility. And it's loose. It never was loose.